Hello guys, welcome to our channel Inspiring Minds. Today we are going to see about the anatomy of the nose.
We know that the journey to becoming a doctor can be difficult, and we are here to help. Through these videos, we will walk with you every step of the way, helping you become a better doctor. Why do we think we can help? Because we're aspiring doctors just like you, who have been there and experienced these difficulties. Make sure to subscribe to our channel, like this video, and hit the bell icon. Welcome to Inspiring Minds.
So, nose is divided into two parts. External nose and internal nose. So, first we are going to see about the external nose. So external nose is made up of bony as well as cartilaginous part, hence it is termed as osteocartilaginous. So which bones are involved in the formation of the external nose? So first you can see the nasal bone, each on one side, frontal process of maxillary bone and the nasal process of frontal bone. So three bones are involved. Out of them, two are paired and one is unpaired. So ostia part, two paired and one unpaired. So the two paired bones are nasal bone and maxillary bone. Since they are present on each side, hence they are paired bone. The unpaired bone is frontal bone, that is nasal process of the frontal bone. Okay, this is the nasal process of the frontal bone, you can see in the diagram. Now you might have one question that nasal process are also present on the either side, but they are not two separate bone just because they are part of a single bone, that is frontal bone. Nasal bone are two separate bone present on each side. So this is about the ostium. Next is cartilaginous portion. So cartilaginous portion is divided into upper lateral cartilage. So this is upper lateral cartilage. Just below it is lower lateral cartilage. Just lateral to lower lateral cartilage is sesamoid cartilage. And last but not the least is this cartilage forming the midline. I hope you are not able to see. Now it is quite clear. You can see the cartilage between the two upper lateral cartilage forming the support to the dorsum of the nose, that is quadrilateral cartilage. This is quadrilateral cartilage. So why it is termed as quadrilateral cartilage? If you have seen the nasal septum or medial wall of the internal nose, it is present on the anterior-inferior part. So if this is the nasal septum, it is present in the anterior-inferior part. It has a shape of the quadrilateral. It has a shape that is in quadrilateral nature, hence it is termed as quadrilateral cartilage. This is the dorsum of the nose. So in the lower 1/3 portion is formed by the anterosuperior border. This is anterosuperior border, this is posterior superior border, this is inferior border. So anterosuperior border forms the dorsum of the nose or provides support to the nose. So if there is damage to this cartilage, it will cause saddling of the nose. This is quite common during trauma. If there is a sudden trauma to the nose, it causes accumulation of the blood, that is hematoma. Now this hematoma acts as a nidus for the infection. Now this infected septum is more prone to ischemia, and soon it will cause the quadrilateral cartilage necrosis. And if the quadrilateral cartilage get necrosed, the support which was provided by the quadrilateral cartilage to the dorsum of the nose will not be provided, and there will be saddling of the nose. What do you mean by saddling of the nose? Means there is a depression in the nose. Normal nose appears like this. If there is a depression in the nose due to the due to the necrosis of the cartilage, then it is termed as a saddling of the nose. So this is about the cartilaginous portion. Now one more question, why it is termed as upper lateral cartilage and lower lateral cartilage? So if you have seen the nose from below upward, it could appear like this. So this is the lateral wall, this is the medial wall formed by the nasal septum. The lateral wall is formed by the cartilages which are termed as lateral cartilage. Now this one is present in the upper portion, hence termed as upper lateral cartilage. This one is present in the lower portion, hence termed as a lower lateral cartilage. Very simple. Junction between the two, if you are able to see the junction between the two, there is an intercartilaginous junction. This is the intercartilaginous junction. This is termed as Lyman nasi. Lyman nasi is an important anatomical landmark because here we are giving intercartilaginous incision. Intercartilaginous incision during rhinoplasty. This is an important question. So during rhinoplasty, intercartilaginous incision is given at the Lyman nasi, which is the junction between the upper lateral cartilage and the lower lateral cartilage. Now next important anatomical landmark is nasion and rhinium. So what is nasion? The junction between the nasal bone and the frontal bone. This is frontal bone, this is nasal bone. Junction between the two is termed as nasion. Now the cartilaginous portion, this is the cartilaginous portion where it meets with the bony portion. This is termed as rhinium. This is rhinium. Okay, so let's have a quick recap or review of what we have learned here. The external nose is made up of the bony as well as cartilaginous portion, hence it is termed as osteocartilaginous. Then which bones are involved? Nasal bone is involved, and after nasal bone is involved, and after nasal bone, maxillary bone is involved, that is frontal process of the maxillary bone. Then frontal bone is involved, that is nasal process of the frontal bone. In the cartilaginous portion, upper lateral cartilage is involved, lower lateral cartilage is involved, just lateral to lower lateral cartilage, sesamoid cartilage is involved, and dorsum of the nose formed by the anterior superior border of the quadrilateral cartilage. Very good. This is the nasion, the junction between the nasal bone and the frontal bone. Junction between the cartilage and the nasal bone is termed as rhinion, and this is Lyman nasi. So everything is quite clear from this diagram. So now we will deal about the internal nose. So internal nose is made up of internal nose. So internal nose is present like this. Now there is a medial wall or the septum. There is a nasal septum which divides the nose into two nostrils. Nasal septum divides the internal nose into two nostrils. Each one has its lateral wall, medial wall, roof and floor. Everything is clear from this diagram, I hope so. So internal nose is divided by the nasal septum into the two nostrils. Each nostril has lateral wall, medial wall, roof and the floor. So we are going to in detail talk about the lateral wall, medial wall, roof and floor. Before that, we are going to just take a recap at the epithelial lining of the nose or the internal nose. So anterior-inferior quadrant. This is the anterior-inferior quadrant of the nose. So the anterior-inferior quadrant of the nose is the continuation of the skin epithelia. So I hope you all know the epithelium of the skin. Yes, correct. It is stratified squamous. Epithelium. So stratified squamous epithelium continues in the anterior-inferior quadrant. Plus, as we all know that in the skin there is a presence of sweat gland. sebaceous gland, and hair follicle. Hair follicle are very fine, so they are termed as Vibriaceae. Vibriaceae. I hope everything is clear from this. So the anterior inferior quadrant, very simple. Anterior inferior quadrant is a continuation of the skin epithelium. So it is made up of stratified squamous epithelium. Along with it, it has sweat gland, sebaceous gland, and Vibriaceae. So Vibriaceae are the fine hair-like structures. If you know that if there is an infection of this hair follicle, there is a particular term given to it known as furuncle. Exactly. So furuncles are most common in which quadrant? Very simple. If you know the epithelial lining, it is the anterior inferior quadrant of the nose. So this is a furuncle. Which bacteria is involved? Staphylococcus aureus. Infection of the hair follicle by the Staphylococcus aureus causes furuncle, which is a very painful condition, occurs in the anterior inferior quadrant of the nose. Very simple. Now, we all know that in the upper 1/3 part of the nasal cavity, there is a presence of the specialized epithelium, which is responsible for the sense of smell. So let's see, this is the upper 1/3 part of the nasal cavity. Upper 1/3 part of nasal cavity means upper 1/3 lateral wall, upper 1/3 medial wall, and the 1/3 roof is covered by a specialized epithelia known as olfactory epithelia. Olfactory epithelia. These are nothing but olfactory nerves. Now this olfactory nerves passes through the cribriform plate of the ethmoid bone and forms the ethmoid bulb. They are responsible for the sensation of smell. So very clear, in the upper 1/3 part of the nasal cavity, there is a presence of the specialized or sensory epithelia known as the olfactory epithelia. Now the remaining of the nasal cavity is lined by the epithelia of the respiratory tract. Now you might be clear what is the epithelia of the respiratory tract. So respiratory tract is lined by, yes, very good, it's lined by pseudostratified ciliated columnar epithelium. So very simple, it is lined by the ciliated columnar epithelium, pseudostratified ciliated columnar epithelium. So it has a particular name. It acts like a membrane in the nasal cavity and it is named as Schneiderian membrane. The pseudostratified ciliated columnar epithelium of the nasal cavity is termed as Schneiderian membrane. Just keep this thing in mind. Okay, so this is about the epithelial lining of the nasal cavity. Now comes the lateral wall of the nose. So first we are going to talk about the lateral wall of the nose and then we are going to talk about the medial wall of the nose. So this is lateral wall of the nose. Lateral wall of the nose, if we are seeing the lateral wall of the nose, then there are 3 bony projections in the lateral wall. 3 bony projection in the lateral wall. So what are they? The 3 bony projections are termed as concha. 3 are termed as concha. One which is present in the upper part, it is termed as superior concha. In the middle part is termed as middle concha and the inferior part is called as inferior concha. They are also termed as turbinates. So they can also be named as superior turbinate, middle turbinate and inferior turbinate. Inferior turbinate is the largest turbinate. From the diagram it is quite clear that inferior turbinate extend from the anterior part to the to the posterior part, to the whole of the length of the nasal cavity, from this to this. This is the inferior turbinate. Middle turbinate is present in the posterior half part. In the posterior half part there is presence of the middle turbinate. In the posterior 1/3 part there is a presence of superior turbinate. I hope I am clear. Inferior turbinate is the largest turbinate. It is present in whole of the length. It is present in whole of the length. Okay? And middle turbinate is present in the posterior half, and superior turbinate is present in the posterior 1/3 of the nasal cavity. What is the function? Why God has created this concha? So just consider, if this is the line, if this is the nasal cavity, lateral wall of nasal cavity, it would be lined by this epithelium. This is the epithelium of the nose. Just consider, by the way, what's the function of this epithelia? The function of this epithelia is to humidify air and regulates its temperature. So humidification and temperature regulation are the function of the epithelia. So whenever we are breathing a dry air or breathing a high temperature air, so it is the function of the air, it's the physiology of the epithelium of the nose to maintain its temperature and to provide it sufficient moisture so that the respiratory epithelia or the respiratory tract is not damaged. So just consider this epithelial lining and just consider this one. So which one will provide more surface area? I hope you are clear from the diagram. The second one will provide more surface area. If it provides more surface area, then there will be better temperature regulation and better humidification. So for the better temperature regulation and humidification, God has created this 3 bony projections. So from which bone does this 3 bony projection arises? Very simple. Upper the superior and the inferior turbinate, the superior and the middle turbinate. Superior and middle turbinate are part of ethmoid bone. We are going to see in detail about the ethmoid bone. First, you just keep in mind that they are the part of the ethmoid bone. And inferior turbinate, very important question. Inferior turbinate is not a part of any bone. It's an independent bone. So please keep this in mind. It is an independent bone. Now one question for you. Which of the bone articulates with the ethmoid bone? Listen the question very carefully. Which of the bone is articulating with the ethmoid bone? Option number A, superior turbinate. Option number B, middle turbinate. Option number C, inferior turbinate. Option number D, all of the above. All of above. AOA. So what do you think? What will be the answer? So if you are thinking superior or middle turbinate, then you are wrong, because they are part of the ethmoid bone. Inferior turbinate is an independent bone which articulates with the ethmoid bone. So just keep this thing in mind. It is a part of the ethmoid bone. It is not a part of the ethmoid bone. It articulates with the ethmoid bone. This is a very important and very frequently asked question. So just keep this thing in mind. Next, we'll go in detail about each of the structures. So this is the ethmoid bone. This is what? Ethmoid bone. So ethmoid bone, we are going to see one by one. This is the lateral, this is the medial part, this is superior, and this is inferior. I hope every dimensions is clear to you. This is the ethmoid bone. So medially, which you are able to see, is the perpendicular plate of ethmoid. It is what? Perpendicular plate of ethmoid. So if we'll see the diagram of the nasal septum, I'll show you. This is the diagram of the nasal septum. You just see this part. This part. 1 minute. This part. This is the perpendicular part of the ethmoid bone. Perpendicular plate of the ethmoid bone. So perpendicular plate of ethmoid bone is responsible in the formation of medial wall of nasal cavity. or formation of nasal septum. So what is meatus? So just consider this is the concha. Sorry for my worst drawing, even not bad. So just consider this as an concha. So just lateral to the concha, this is nose. I hope everyone is clear. This is nose. This is medial wall of the nose that is formed by the nasal septum. Okay, so just lateral to the concha, there is a presence of a space which is termed as meatus. This space is termed as meatus. In this meatus, there is opening of various structures. So I hope meatus is clear to you. Just lateral to the concha, there is an opening which is termed as meatus. So just lateral to inferior turbinate, just lateral to inferior turbinate, there will be inferior meatus. So now the question, which structure open in the inferior meatus? So inferior meatus, first one liner which is very important, it is the largest meatus. Why it is largest meatus? Because inferior turbinate is the largest turbinate, so inferior meatus is the largest meatus. So which structure open into the inferior meatus? So nasolacrimal duct opens. So nasolacrimal duct open at the point which is the highest junction, which has the highest height. So this is the point. Here it opens. If you are able to see, this is the nasolacrimal duct opening, which is guarded by a wall that is known as what? It's known as exactly valve of Aashray. Good. So next question. What is medial meatus? I hope you are now clear. Okay. So medial meatus is lateral to the middle turbinate. So next question. Which all structures open in the middle meatus? Very important question, because middle meatus is one of the potential site of sinusitis, from where sinusitis extends. So let's see. In the middle meatus, there is a presence of this bony projection. If you are able to see this bony projection, which is termed as bulla ethmoides. So what is bulla ethmoides? So just see this diagram. In this diagram, you are able to see this is the ethmoid bone. This is the ethmoid bone. This is ethmoid bone. This is superior turbinate. This is middle turbinate, and this is the just below. Just if we will cut the middle turbinate some portion, we will be able to see the bony projection of the ethmoidal air cells. During the process of the pneumatization, some of the ethmoid bone extend in the middle meatus, forming a bony projection. It is termed as bulla ethmoides. So this is the bulla ethmoides. What is bulla ethmoides? Bulla ethmoides are the ethmoidal air cells. Okay. Just below the bulla ethmoides, you will be able to appreciate this. This is the sickle-shaped bone. Sickle-shaped bone, which is a part of which one? Ethmoid bone. You remember I have told you one name, uncinate process. So this is that uncinate process. So above there is presence of the bulla ethmoides. Just below there is uncinate process. Uncinate process is a sickle-shaped bone of sickle-shaped bone, which is a part of ethmoid bone. So you must remember this thing. Now, if the mucosa will run above the bulla ethmoides, now just consider this is the bulla ethmoides, and below there is a running of the uncinate process. So mucosa runs over like this. Mucosa comes, run over like this, goes like this, and comes and run over the uncinate process and go like this. So it creates a depression-like structure between the bulla ethmoides, that is this depression. Mucosa will create this depression in the shape of the semilunar, not full, not half. It is semilunar. That is hiatus opening semilunaris. It is termed as hiatus semilunaris. So this is known as hiatus semilunaris. So hiatus semilunaris is present between, this is another very important question. It is present between ethmoidal air cells leading to the formation of bulla ethmoides and uncinate process, which is in sickle-shaped bone, a part of the ethmoid bone. So everything is clear from this diagram. Just we can recapitulate. This is the bulla ethmoides, and just below this is the sickle-shaped bone, that is uncinate process. The gap between the two, it is the hiatus semilunaris. We'll go back to the diagram. So now we will be able to appreciate everything better. So this thing which you are able to see is the bulla ethmoides. So this is bulla ethmoides. Just below it, this is hiatus semilunaris, and just below this there will be the uncinate process of the ethmoid bone, which is in sickle shaped. Next, what all structure that are opening in this middle meatus? So first, frontal sinus. If you are able to see, this frontal sinus opens into the middle meatus via recess, which is also misnamed as frontal duct. It is not an duct, it is just an recess. So frontal duct, through frontal duct it opens into the anterosuperior portion of the middle meatus. On the bulla ethmoides, there will be opening of ethmoidal air cells. So which ethmoidal air cells? Now according to anatomy textbook, ethmoidal air cells are divided into anterior, middle and posterior. However, in the ENT it is referred as anterior and posterior. So according to ENT, anterior group of ethmoidal air cells open on the bulla ethmoides. According to anatomy, middle ethmoidal air sinus open into the bulla ethmoides. So this is a controversial point which you must remember, but according to me you must remember of the ENT. So I prefer remembering anterior ethmoidal air cells open into the bulla ethmoides. Next and very important question. If we pass a wire into the hiatus semilunaris and then we enter a three-dimensional structure, then that structure is, so very simple. If we pass in wire, so consider this wire, if we pass through this, then the posterior end contains an opening that will lead to infundibulum, and that will lead to maxillary air sinus. So just remember this thing, that the maxillary air sinus open into the posterior part of the hiatus semilunaris. So if this is hiatus semilunaris and this is bulla ethmoides, here there will be opening of the frontal, here there will be opening of the ethmoidal air cells, here there will be opening of the maxillary air cells. So now you consider if there is an infection of the frontal sinus, that is sinusitis, frontal sinusitis. Now the drainage of the frontal or the pus or the infected part of the frontal sinus or the frontal discharge will easily go into the maxillary and easily go into the ethmoids, will easily go into the maxillary and the ethmoid, thereby causing inflammation of maxillary as well as ethmoid. That means inflammation of one can lead to the inflammation of other two. That leads to the name osteomeatal complex. osteomeatal complex. Because of the multiple opening, infection of one can lead to the infection of other, hence it is also known as osteomeatal complex. It is also known as Picadal circle. Picadal's circle, very important question. What is Picadal circle? Infection of one of the sinus can lead to the infection of other sinus. Now, one more important question from you. Which of the sinuses is the most commonly involved in the infection? Your options are, there are 4 sinuses, I hope you all know. First, maxillary sinus. Second, sphenoidal sinus. Third, frontal sinus. And fourth, ethmoidal sinus. So the answer to this question is maxillary sinus. Why? If you have seen the maxillary air sinus, it is like this. So all the drainage that comes from the epithelial lining, will accumulate in the base. So due to the drainage pathway higher than the base, this is the drainage pathway, and it is higher than the base, that leads to the, or anti-gravity position of the drainage leads to the maximum chance of infection of the maxillary air sinuses. So maxillary air sinuses are the most commonly involved in the infection, maxillary sinusitis. Next important question. Which of the sinuses are first to form another maxillary air sinus? Which is the largest air sinus? Another important question. It is maxillary air sinus, most commonly involved in infection, first to form, and largest air sinus. So these are the maxillary air sinus. And next important structure which is present in the superior meatus. I hope it is clear what is superior meatus. Just lateral to the superior turbinate there will be space which is termed as the superior meatus. There is opening of posterior ethmoidal air cells. So posterior ethmoidal air cells open in the superior meatus. So just keep everything quite simple. In the inferior meatus, nasolacrimal duct guarded by valve of Aashray. Second, middle meatus is also known as osteomeatal complex, or it's also termed as osteomeatal complex, or very good, Picadal circle. Very good, Picadal circle. Next, what are the openings? Frontal sinus, maxillary sinus, ethmoidal air sinus. What are the 2 important structures? Bulla ethmoides, hiatus semilunaris. Next, superior meatus, posterior ethmoidal air cells. That's it. Now, sometime it's very rare, there is a presence of one more bony projection above the superior turbinate. Very rarely it occurs. Very rarely above the superior turbinate there is a projection, bony projection, which is termed as supreme turbinate. It is present above the superior turbinate, and it is the 4th turbinate. You must remember this for the MCQ point of view. Nothing clinically correlated to this thing. So you must remember this thing. And where the sphenoidal air cells open, it opens in the spheno-ethmoidal recess. That is the gap between the sphenoid and the ethmoid, spheno-ethmoidal recess. So next point. This is the lateral wall of the nose. You can see here that the ethmoid bone, this is the inferior turbinate. It is an independent bone. Superior and middle turbinate are the part of the ethmoid bone. So the ethmoid bone also give a bony projection termed as bulla ethmoides due to the air cells, and this is the uncinate process, another process from the ethmoid bone. You can see in this diagram that this bone, it is named as inferior turbinate. It also articulates with the uncinate process, that is ethmoid bone. So articulation, which bone articulates with the inferior turbinate or ethmoid? Which bone articulates with the ethmoid bone? So it is inferior turbinate. So just keep this thing in mind. Next. So now we have deal about the lateral wall of the nose. So if we want, we can have just a quick recap. Before recap, I will ask you some more questions, some clinically correlated questions. If we follow the inferior turbinate, then we will end up into which structure? अगर हम इसे फॉलो करते हैं तो हम कौन सा स्ट्रक्चर को एनकाउंटर करेंगे? सो इफ यू फॉलो द इंफीरियर टर्बिनेट, इफ यू पास अ थ्रेड और एनी metal piece through the floor of the nose, then we will reach the exactly Eustachian tube. So what is Eustachian tube? From the middle ear there is a connection which open into the lateral wall of the nasopharynx till the inferior turbinate. If you all know, till the inferior turbinate or the turbinate, this is the lateral wall of the nose. Just where the turbinates end, there is a start of the lateral wall of the nasopharynx. So in the lateral wall of the nasopharynx there is opening of the Eustachian tube. If you know there is a condition, what is the function of, first of all, what is the function of the Eustachian tube? Eustachian tube function is to maintain the middle ear pressure to the atmospheric pressure. We are going to see one condition in the ear section, that is known as patulous Eustachian tube. What is patulous Eustachian tube? Patulous Eustachian tube क्या होता है? So patulous Eustachian tube is patent Eustachian tube. Normally Eustachian tube is guarded by Ostman pad of fat. Ostman pad of fat. Just consider if there is sudden loss of weight, this Ostman pad of fat is degenerated. That lead to the patulous Eustachian tube. Okay, that is patent Eustachian tube. So why this patent Eustachian tube is particularly dangerous? Any of the infections or any of the fluids can easily reach the middle ear cavity and cause various conditions like ASOM, or which can further on progress to the chronic conditions or any complications. So this you must remember. If we follow the inferior turbinate, we will reach the if we follow the inferior meatus, we will reach an important structure that is known as Eustachian tube opening. So another important structure which is related to the middle meatus, that is, if we pass a straight wire or probe through the middle meatus, then we will reach the posterior wall of the nasopharynx, which is formed by the nasopharyngeal adenoids, nasopharyngeal adenoids. One more very much important structure which is related to the middle meatus or just on the lateral wall is an opening or a foramen which is known as Spinopalatine foramen. This is named as Spinopalatine foramen. So what is the importance of the Spinopalatine foramen? Through the Spinopalatine foramen there is entry of an artery named as Spinopalatine artery. It is the main artery of the nasal cavity. It is the main artery of nasal cavity. Since it is a main artery of the nasal cavity, hence it is the most commonly involved artery in the epistaxis. So just 1 centimeter posterior to the middle turbinate and just inferiorly there is a presence of the foramen which is termed as Spinopalatine foramen. It is termed as Spinopalatine because it connects nasopharynx laterally with the Spinopalatine fossa. hence it is termed as Spinopalatine foramen. So that's it. So two important structures which are related to the middle meatus are nasopharyngeal adenoids if we pass posteriorly, and on the lateral wall posteriorly there is presence of what? Spinopalatine foramen. That's it. Now we will come to the medial wall of the nose. So in the lateral wall of the nose we have seen many things. So let's recap. Lateral wall of nose. So lateral wall of nose contains 3 bony projection termed as concha, or very good, turbinates. Sometimes 4 turbinate are present. 4 turbinate is termed as supreme turbinate. It is present above the superior turbinate. So this is a very important and very potential question. Next, very important, what are the opening in the superior turbinate? Opening of posterior ethmoid air cells. In the middle turbinate, opening of osteomeatal complex. Now what is the clinically correlated thing with the osteomeatal complex? So if you consider this, I'm sorry for the diagram. So just consider this. If you see any of the turbinate, it is concave towards the meatus. It is concave towards the meatus. If in condition, normally middle turbinate is not pneumatized. Middle turbinate not pneumatized. That is, it does not contains the air cell and it is concave towards the meatus. So in condition, if there is pneumatization of the middle turbinate, it will cause bulging of the margin. So that will lead to blockage of the opening of all the sinuses and thereby causing multiple sinusitis. So this is a condition known as concha bullosa. In this condition, there is pneumatization of the middle turbinate, and due to the pneumatization of the middle turbinate, the normal convex or concave free margin get converted into convex margin, due to which drainage of the various sinuses become impossible. And since there is drainage, the pathway of the drainage become blocked, it acts as a potential site for the infections, and through this infection it causes sinusitis of the multiple sinuses. So this is a very important clinically correlated thing. Next thing, so you must remember this, concha bullosa. Next it is also known as osteomeatal complex, is also known as Picard's circle. Next, inferior turbinate, opening of nasolacrimal duct guarded by valve of Aashray. Very good. So this is a very important question. Middle turbinate is related to Spinopalatine foramen. This is related to, very good, Eustachian tube. Eustachian tube dysfunction in the patellus Eustachian tube. And Spinopalatine foramen clinically correlated thing is, if the patient is present with the persistent epistaxis, then the arterial ligation of the Spinopalatine artery is done at this foramen. If you want to approach the Spinopalatine foramen, then Caldwell's Luck approach is used, that we will see in the further sections. So now comes the next part, that is medial wall of the nose. So medial wall of the nose, that is nasal septum. So as we have discussed earlier, if this is the internal nose, nasal septum divides the internal nose into 2 nostrils. So each nostril contains lateral wall, medial wall. So this medial wall is formed by the nasal septum. So nasal septum is osteocartilaginous, that is made up of bone as well as cartilage. From the diagram you can see that it is divided into 4 quadrants. If you see, this is, sorry for the rough diagrams. So okay, this is anterior, this is posterior, this is superior, and this is inferior. So this is antero-superior, this is antero-inferior, this is posterior-superior, and this is posterior-inferior. So most of the anterior part is formed by the cartilage that is quadrilateral in shape, so termed as quadrilateral cartilage. So quadrilateral cartilage is quadrilateral in shape, having antero-superior border, posterior-superior border, and inferior border. Posterior-inferior border and inferior border. So antero-superior border, it forms the dorsum of the nose. Antero-superior border forms the dorsum of the nose and thereby supporting the nose. If there is damage to this cartilage, that will lead to the saddling of the nose. So posterior-superior border articulates with a bone which is arising perpendicularly from the ethmoid bone, So it is termed as perpendicular plate of ethmoid bone. In the posterior-inferior part, it is articulating with another important bone which is termed as vomer bone. In the inferior part, it is articulating with the nasal crest of maxillary bone and nasal crest of palatine bone, horizontal process of palatine bone. So this is the framework of the medial wall or the nasal septum. So nasal septum is formed of the cartilaginous portion in the anterior part, that is formed by the quadrilateral cartilage. Quadrilateral cartilage antero-superior portion supports the dorsum of the nose. If there is damage to this cartilage, it will lead to the saddling of the nose. Now this is the portion that is posterior-superior portion. It articulates with the perpendicular plate of ethmoid. This is posterior-inferior portion, articulates with the vomer bone, and this is the inferior portion which articulates with the nasal crest of the maxillary bone and the nasal crest of maxillary bone and nasal crest of the palatine bone. Some other bone which are involved is the nasal process or nasal spine of the frontal bone, and small projection from the ethmoid and sphenoid bones are involved. Sphenoid bone, sorry, not ethmoid bone. Sphenoid bone is also involved. So this is the part. So posterior part is made up of the perpendicular plate of ethmoid bone, and posterior inferior part is made up of posterior-superior part is made up of perpendicular plate of ethmoid bone. Posterior inferior part is made up of vomer. So all the things are clear, I hope, from the diagram. It is divided into 4 quadrants: antero-superior, antero-inferior, posterior-superior, posterior-inferior. Antero-superior. So most of the anterior portion by the quadrilateral cartilage, posterior-superior by the bone, bone coming perpendicular from the ethmoid, perpendicular plate of ethmoid bone, and posterior-inferior quadrant which is by the vomer bone. So this is it. This is the medial wall of the nasal septum. So this you must remember about the medial wall of the nasal septum. Now we have deal about the lateral wall, medial wall. Now the 2 topics which are remaining are roof and floor. So we will also see about the roof and the floor. So roof of the nasal cavity, it is formed by the cribriform plate, medial lamella. Very good. We all know that ethmoid bone in the superior part is made up of the cribriform plate. In the medial part it forms the roof of the nasal cavity, that is medial lamella. In the lateral portion it forms the roof of the ethmoidal air cells known as lateral lamella. So this is correct. Very good. Floor is formed by this is maxillary bone. I hope you know. This is the palatine process of maxillary bone. So palatine process of maxillary bone, and in the posterior part horizontal plates of palatine bone. So two bones which are involved in the formation of the floor are palatine process of maxillary bone and horizontal process of palatine bone. I hope everything is clear now. Lateral wall, medial wall, roof and floor, all the anatomy related to it, epithelia, external nose. Now we come to the blood supply. So the arterial supply of the nose is by both external carotid artery and internal carotid artery. So which branch of the external carotid artery and which branch of the internal carotid artery? First, you must remember it is one of the most important site where anastomosis of external carotid artery and internal carotid artery occurs. This is a very important question. Now, next question, that which branches of external carotid artery is involved? So if this is the common carotid artery, at the level of the thyroid cartilage upper lamella, it will divide into the two portions, that is external carotid artery and internal carotid artery. Internal carotid artery, without giving any of the branch in the neck region, enters the base of the skull. So it enters the skull through the carotid canal and then it traverses the cavernous sinus, take a U-turn. This U-turn is taken just to reduce the blood pressure flow that can lead damage to the neurons. So this turn reduces the pressure. Now during this passage it gives a branch named as ophthalmic nerve. So ophthalmic nerve, it's not ophthalmic nerve, it's ophthalmic artery. Ophthalmic artery gives two branches, anterior ethmoidal artery and posterior ethmoidal artery. Now if you know the medial wall of the orbit, just consider this is the medial wall of the orbit and this is the lacrimal crest. Just 24 millimeter behind the lacrimal crest there is a presence of an opening which is for the anterior, which is termed as anterior ethmoidal foramen. Anterior ethmoidal foramen. 12 millimeter behind there is an opening which is posterior ethmoidal foramen. Through the anterior ethmoidal foramen there is a passage of the anterior ethmoidal nerve, and through the posterior ethmoidal foramen there is passage of the posterior ethmoidal nerve. Posterior ethmoidal foramen is clinically important because just 6 millimeter behind it is related with the optic nerve. So this is a very important question. Why it is important? So it is important because just 6 millimeter behind it is related with the optic nerve. So it is clear that anterior ethmoidal artery and posterior ethmoidal artery, which are branches of the ophthalmic artery, which in turn is a branch of the internal carotid artery, enters the nasal cavity via this foramen, and now it supplies the part present above the middle turbinate. So above the middle turbinate there is blood supply by the internal carotid artery. I hope I am clear. Next, external carotid artery gives many branches, among which superior thyroid artery is the first branch, and it terminates by giving two branches, that is temporal branch and transverse facial branch. Just below this, or just before this, it gives a branch which is termed as maxillary artery. Maxillary artery is divided by the lateral pterygoid or this pterygoid muscle into three parts. Finally, it terminates in the spinopalatine fossa and gives two branches. One branch is spinopalatine artery and second branch is greater palatine artery. So greater palatine artery passes through the greater palatine canal and then through the greater palatine foramen, supplies the palate, and then via canal it enters the nasal cavity and supplies the lowermost portion. The spinopalatine artery passes through the spinopalatine foramen and supplies the nasal cavity in the most of its portion. So this is the main artery of the nasal cavity. Since it is the main artery of the nasal cavity, the main supply of the blood will be from the external carotid artery system. So the main blood supply is from the external carotid artery system. Most of the blood will be given by the spinopalatine artery. Most common artery involved in the epistaxis will be the spinopalatine artery, and there will be ligation of the spinopalatine artery in the cases of the prolonged epistaxis. So I hope I am clear. Next point is, so we have seen one branch of external carotid artery. So we have seen one branch of the external carotid artery. The next branch of the external carotid artery is facial artery. So facial artery So facial artery arises from the external carotid artery. It has a course in the neck. Now it emerges in the face at the so just consider this is masseter muscle. So at the anterior-inferior quadrant or the anterior-inferior part of the masseter muscle, the facial artery emerges in the face. Facial artery now has a tortuous course, runs through the face and ends near the medial wall of the eye. So why it is having the tortuous course? So to accommodate the extra length during the facial contractions. Just consider if it is having a specific length or if it is stiff, then during the facial movement it can get easily torn and it may lead to the bleeding. So to avoid the bleeding and the hematoma formation, it has a tortuous course. It gives three branches: superior labial branch, inferior labial branch, and nasal branch. Okay, superior labial branch, inferior labial branch, and nasal branch. This superior labial branch also supplies the nasal cavity anterior-inferior quadrant. So arteries involved in the supply of the nasal cavity are, in short, we are going to summarize this in the table. So what are the arteries involved? So it is divided into external carotid artery, which is the main system, and the internal carotid artery. Internal carotid artery once enters the cranium, it gives ophthalmic artery. Ophthalmic artery gives branches named as anterior, ethmoidal, and posterior ethmoidal. Leaves the orbit, enters the nasal cavity by anterior ethmoidal foramen 24 millimeter from the nasal lacrimal crest, enters the nasal cavity from the posterior ethmoidal foramen, 12 millimeter from the anterior ethmoidal foramen. So just remember, it is 24 millimeter from lacrimal crest. This is 12 millimeter from anterior ethmoidal foramen. It is clinically important because just posterior to it, just 6 millimeter posterior to it, there is presence of the optic nerve. So this is about the internal carotid artery system. It supplies mainly above the middle turbinate. I hope everything is clear now. Now external carotid artery. External carotid artery gives two important branches: maxillary artery, facial artery. Facial artery gives branch superior labial artery. Superior labial artery gives a nasal branch. Maxillary artery terminates in the spinopalatine fossa, gives spinopalatine artery, which is the main artery of the nose. Main artery of the nose, most commonly involved artery in the epistaxis, artery ligated in the epistaxis. Next is greater palatine artery, which also supplies the anterior inferior quadrant of the nose. So this is the nutshell of the arterial supply. So if you all know that if this is the nasal septa, on the nasal septa there is an area which is most commonly involved in the epistaxis in the nose pickers. It is termed as Little's area. Little's area. It's known as Little's area. Epistaxis, most common site of epistaxis in nose pickers. Okay. So why it is a particularly important site of epistaxis? It is present in the anterior inferior quadrant. First of all, why it is an important site for the epistaxis? Because here there is anastomosis of four important arteries. They are anterior ethmoidal artery, spinopalatine artery, superior labial branch, nasal branch of the superior labial artery, and greater palatine artery. So what were the artery? Anterior ethmoidal artery, spinopalatine artery, nasal branch of superior labial artery, and greater palatine artery. So these are the branches leading to the formation of the plexus of the anastomosis, that is known as Kiesel-Beck plexus. Potential site for the epistaxis in the nose pickers. It is present on the nasal septum. So this point you must remember. Which artery is not involved in the Kiesel-Beck plexus or the Little's area? Very important question. Posterior ethmoidal artery. Posterior ethmoidal artery does not involve in the Kiesel-Beck area. It just supplies in the superior portion. It does not come inferior in the anterior inferior quadrant. So you must keep this thing in the mind. So now the next question. This is my question to you, and I expect your answer for this question in the comment section. I will give answer to this question and all your doubts and queries related to this video in the comment section or in the further video section. So my question is, most common site of bleed in hypertensive patients. So this is a very easy question. I expect your answers in the comment sections. So Now the next important thing is nervous supply. So what is the nervous supply of the nose? First sensation of smell, that is by the olfactory epithelium. So olfactory epithelium, as we have discussed earlier, it is present in the upper 1/3 of the nasal cavity, that is upper 1/3, lateral wall, medial wall and the roof. So once the chemical of the aroma or the chemical of the smell get dissolved in the epithelia, so chemical dissolved in the epithelia lead to the stimulation of the olfactory epithelium or the olfactory nerve. Now this nerve will carry the stimulation to the olfactory bulb via cribriform plate, and then it will reach the olfactory tract, then temporal lobe, and then in the superior temporal gyrus. If this is temporal lobe, this is divided into superior temporal gyrus. In the posterior part there is a sense of smell. Okay, so this point you must remember. Now the next is the secretomotor supply. Since it is having mucosa, then there will be also secretomotor supply, that is parasympathetic supply. So how does parasympathetic supply comes? So I'll show you. Very simple. Just consider this is medial wall of the middle ear. So in the medial wall of the middle ear, you can see first the internal acoustic facial nerve. Facial nerve originate from the very good from the pons, and then it enters the skull region through the internal acoustic meatus. So internal acoustic meatus is present in the posterior slope of the petrous bone. This is the internal acoustic meatus. Now if I'll draw the diagram of the internal acoustic meatus is divided into two parts, superior and inferior, by a crest which is known as falciform crest. The superior part is divided into anterior and posterior by the Bill's bar. So this portion, anterior-superior portion, is occupied by the facial nerve. So this is the facial nerve. So facial nerve travels the internal acoustic meatus, reaches the inner ear, then from the inner ear it reaches the medial wall of the middle ear. This is the medial wall of the middle ear. From the medial wall of the middle ear it comes and take a horizontal turn, and then it runs vertically downward in the posterior wall of the middle ear. We will deal about this in the ear section, so you don't need to worry about this here. We will go in detail about this section, so you just keep small things here in mind, and then we will see about the ear in the ear section. So here there is a presence of a ganglion which is at the first geno or the first term, which is termed as geniculate ganglion. From the geniculate ganglion there arises a branch known as greater petrosal nerve. Now this greater petrosal nerve runs in the bony canal. It comes out of the base of the skull, and joins the sympathetic plexus around the carotid system, and then it runs through a bony canal. Now just imagine this. This is the pterygoid plates, lateral pterygoid and medial pterygoid. In the root of this there is a hole, that is nerve to pterygoid canal. Now this is the pterygoid canal. Just here is the maxillary antrum, and here is the orbit. In this gap is known as spinopalatine fossa. It contains spinopalatine ganglia. So great petrosal nerve joins with the sympathetic plexus, forms the median nerve, traverses through the pterygoid canal, now reaches the spinopalatine ganglia. Here it relays and then supplies the nasal mucosa. So very simple. I hope it is quite simple. So the secretomotor fiber or the parasympathetic supply is from the spinopalatine ganglia. Very important clinically correlated thing is vasomotor rhinitis. What is vasomotor rhinitis? We will see. In some patient due to excessive parasympathetic stimulation, there is rhinitis. Due to parasympathetic secretion, there will be more release of the mucosa, and then there will cause the rhinitis or the runny nose. So in such cases, we do vedianectomy. That is, we cut the vedian nerve. So the parasympathetic supply to the spinopalatine ganglia will not be relayed, and thereby no vasomotor rhinitis will occur. So this is the clinically important thing related to the vedian nerve and the nerve supply. So the last nerve supply is the sensory nerve supply, which is by the ophthalmic and the maxillary nerve. So you must remember, general sensation is by the ophthalmic and the maxillary nerve. So in a nutshell, we will deal sensory. Olfaction or the olfactory. First, chemical mixed in the mucosa of the olfactory epithelial lining, and then olfactory epithelium, that is olfactory nerve, then olfactory bulb, then olfactory tract, and then goes the superior temporal gyrus. Okay, next point. Secretomotor. First, geniculate ganglia, then greater petrosal nerve, vedian nerve, nerve to pterygoid canal, final spinopalatine ganglia, relay, and then nasal mucosa. Also it supplies lacrimal gland. So nasal mucosa, lacrimal gland. Next, general sensation by ophthalmic and maxillary nerve. So that's it about the anatomy of the nose. I hope this is much more than enough related to the anatomy of the nose. If you have any doubt, any queries related to this topic, you can write down in the comment section. And thank you for watching our video. If you like our work, then please like, share, comment, and hit the subscribe button for more such informative videos. And if you want us to make some videos related to your concern, you can write that even in the comment section. Thank you.